New at 6 in our continuing series on money problems at Kona Community Hospital, we take a closer look at the backup plans for cancer patients who could lose access to chemotherapy drugs. Tonight, our Allison Blair explores their options.
Besides Kona Community Hospital, there are two other places patients can receive IV chemotherapy treatment on Hawaii Island. Both tell me they could take on some additional patients, but exactly how many remains unclear. Meanwhile, getting to either of them from the west side means a long drive.
Traffic is really hectic nowadays.
It's one of the many reasons Bruce Brummagem is grateful he lives so close to Kona Community Hospital.
It's very convenient.
Every other Thursday, doctors have him come in for chemotherapy to treat his bone marrow cancer. The IV infusion is made right on site in the hospital's pharmacy. Technicians there stay busy, compounding cancer treatments for scores of patients, totaling more than 500 visits every month. Now, access to those life-saving medications is at risk. That's because the pharmacy could be forced to close if hospital leadership can't convince the legislature to provide it with $2.3 million. That's the rest of the money it needs to finish an expansion project that'll bring the facility up to code.
Patients that we're currently seeing won't be able to receive the care they need. It has a huge effect.
If the pharmacy closes, patients would have to travel to the East Hawaii Health Cancer Center in Hilo, about a 2-hour drive one way, or North Hawaii Community Hospital in Waimea, which is at least an hour drive one way. And that's only if they can get an appointment. We asked both facilities how many additional patients they can treat. East Hawaii Health Cancer Center didn't give us an exact number, instead saying in a statement, we would work with our providers to triage patients with the most acute needs and do our best to care for the needs of our island. Meanwhile, North Hawaii Community Hospital told us it could absorb about 5 to 10 additional infusions per week.
When patients are getting chemotherapy, they're tired, they're sick, they may have nausea, vomiting, diarrhea, and they're in pain.
A lot of the people who come here, the patients, a lot of them not capable to drive and all that. So it would be devastating if they shut this facility down.
We've confirmed both facilities in Hilo and Waimea are already in compliance with those federal regulations set to go in effect November 1st. Allison Blair, Hawaii News Now.